If we're interested in people's health-related behaviours and their sleep quality and the food that they cook and the way that they socialise as a family, the way that their posture changes when they're depressed, we can't do that in the laboratory because you can't make people perform like that. And we would need months of data, and we can't have people living in laboratories for months. So we don't need big laboratories, and we have an office, we don't have a laboratory at all. So what we actually need is a group of citizen scientists, and we have a group called the Friends of Sphere, who are collectively not just the laboratory, but also, in a very real sense, the scientists as well. So our vision is to have a group of people within the city who are providing data and helping us do the research, but also are shaping the research, and in many cases actually driving it. So people who are saying to us, we think you need to do more work in this area, or I'm interested in sleep, and I want to have technology in my house, and I want to run an experiment on my own sleep that I want to share with you. So the vision is not to have a city of like volunteers or participants, but a city of scientists who are active partners and equal partners. People actually designing, so this is one of our Friends of Sphere, essentially actually designing a flow chart for how she wants a Sphere app. She wants a system, quite rightly, that can turn off the sensors. So when she doesn't want to be part of the experiment, she can make the sensors stop. And so we've had citizens involved in how we make the technology more acceptable to them. So where we've got to now is taking us 3 years to get to the point where all the technology is available. So we have 5 years, and the intention was to develop the technology for these health behaviour use cases and then use it, and not use it in the university, but use it with young people, old people, couples, families, the retired, people with mobility problems, everything that you can think of. We're not the same society we were in the 1940s and the 1950s when the NHS was created. There are some things we now know how to do really well around digital technologies, and if we can use digital technologies for autonomous cars and banking and retail and all the other things we use digital technologies for, why can't they transform health in the same way they've transformed everything else?